But we're talking about sugar versus sweeteners today. And this has to do with diabetes, of course. But the incidence of diabetes has been increasing worldwide. And this is according to the World Health Organization. We already know that it's increasing in the United States, but worldwide it's also been increasing. Some numbers are that in 1980, there were about 100 million people worldwide with diabetes. Fast forward to about 2014, and there were 400 million people worldwide with diabetes. That is 4 times the amount, and it's expected to continue growing. We do know that sugar has something to do with it, but what exactly? If you walk down to the street and talk to Joe Blow, they'll have different ideas about it. Sugar causes diabetes, this and that. And people have probably heard that somewhere, but is that really true? That's what we're going to talk about next. So we do know that once you have diabetes itself, the disease, affects the body's ability to regulate sugar levels. And that's because of the problem with insulin. As in type 1, like we talked about, autoimmune is destroying the cells that produce insulin, so there's none around. And then with type 2 diabetes, which happens later on in life, there's insulin resistance. So the insulin is there, it's not working well, or there's just not enough insulin there to begin with. And even if it's there, it's still not working very well. So that's type 2. But research has been ongoing to try and find out if there's a direct link between sugar and diabetes, and really there is no direct link that has been found yet. There's still ongoing research. What we do know is that sugar is indirectly related to diabetes. But how, you ask? How is it related? Well, excess sugar in the diet leads to weight gain, which can lead to obesity, which leads to an elevated body mass index, right? And those things, obesity, elevated body mass index, excess fat, those are risk factors for diabetes. So those can lead to diabetes. That's how sugar indirectly causes diabetes. And then you have excess sugar hanging around, especially fructose, which doesn't get broken down very well by the liver, and then hangs around and turns into fat, and you have fatty liver. This in itself decreases insulin sensitivity, leads to insulin resistance, which also causes diabetes. So too much sugar intake when you already have diabetes also leads to uncontrolled diabetes, which is bad because once diabetes is not controlled, which is considered on average a A1C of greater than 7, and the higher it is, the more uncontrolled the diabetes is. That leads to complications of diabetes, such as eye problems, nerve problems. Once you have the nerve problems, potentially stepping on something, not knowing it, getting an ulcer that you don't even know you have until it's out of control, potentially resulting in amputation. Things like chronic kidney disease, which if that is not controlled can lead to dialysis, which once one is on dialysis, life expectancy is about 5 years. Those are all outcomes of uncontrolled diabetes. In the American diet, our sugar intake has been increasing steadily. In the 1800s, the average adult had about 6 pounds of sugar per year. And fast forward to now, the average adult has about 60 pounds of sugar per year. The American Heart Association actually recommends the following. So an adult male should have 9 teaspoons of sugar per day. That's the average adult male. The average adult female should have 6 teaspoons of sugar per day or less. Less is always good, not more. But the average adult is actually consuming about 17 teaspoons of sugar per day on average 60 pounds per year, which is way too much. 2 to 3 times the average recommended amount. And sugar, as we know, that leads to weight gain, which can then lead to diabetes and other complications. And in fact, my sugar story is this. So during COVID, we were all sort of depressed and staying at home. And that's when I consumed the largest amount of sugar that I've had in my life since I was a kid. That's all I was doing. I was eating candy. I did gain the 10 to 15 pounds during that time period, which then took me a while to get off. But that's what happens with excess sugar. And it's all around us, especially in processed foods, which we eat every day. They're convenient, fast food, but there's sugar and sometimes hidden sugar, which we don't even realize. I encourage you to pay attention to labels. There's other names for sugar, anything that ends in os. So OSE, that's another name for sugar. Sucrose, there's fructose, there's glucose. Lactose is milk sugar, even though milk doesn't taste very sweet to some. Still has sugar in it. Evaporated cane juice, high fructose corn syrup, fruit juice concentrate, that is also sugar. That's just all the sugar taken out of the fruit. And then the vitamins and minerals that are in the fiber are gone, and we're left with the sugar. So those are all sources of added sugar that are found in processed foods to pay attention to. Most recently, the World Health Organization, who I'll refer to as WHO sometimes, the World Health Organization came out with guidelines this year, and they're guidelines for the use of non-sugar sweeteners, which they define as low-calorie or no-calorie alternatives to free sugars. And so those are things like aspartame, neotame, saccharin, sucralose, stevia, and other stevia derivatives. The guideline that the WHO came out with is that they suggest that the non-sugar sweeteners not be used as a means for weight control or for reducing the risk of non-communicable diseases. Non-communicable diseases are diseases that can't be spread from person to person. For example, diabetes is a non-communicable disease, so is heart disease. This is a conditional recommendation, which, what does that mean? It means that this is a recommendation that the World Health Organization is still thinking about the risks of the recommendation versus the benefits are still being weighed, and so they can't come up with definite policies yet, but it's something that they're still working on and still doing research on. And this is what they've come up with so far. So in looking at several studies, looking at the non-sugar sweeteners, they found that there's no long-term benefit for weight loss in people that are using them. There is a short-term benefit. How did they describe short-term? So short-term was described as 3 months or less. Long-term was described as 6 to 18 months per this guideline. So in the short term, they did find that there was some weight loss benefit. However, it did not change levels of glucose or insulin levels or cholesterol levels, just weight in the short term. But in the long term, there was no benefit for weight or control or reducing the risk of the non-communicable diseases, like we talked about. They did find out in the long term, though, the non-sugar sweeteners or the artificial sweeteners did have some negative consequences. So increased risk for development of diabetes, type 2, increased risk for cardiovascular disease, increased risk for all-cause mortality, so increased risk of death from complications, increased risk of possible preterm birth in pregnant females. Also, a very low risk of bladder cancer, and that's specifically with the use of saccharin. Saccharin was studied by the FDA in the 1970s because there was concern that it was causing bladder cancer in rats. However, with studies, the FDA found that it didn't really translate to humans, didn't really cause the bladder cancer in humans. So saccharin is authorized and it is used as an artificial sweetener in the US today in products such as Sweeten Low, for example. And of note, the WHO says it's very low risk. And so on one of the studies that the World Health Organization looked at, also some of the studies, the regular sugars were replaced with the non-sugar sweeteners. But the foods that were replaced are basically highly processed foods. Highly processed foods are usually where you find these refined sugars. And so they just replaced the refined sugar then with a non-sugar substitute, but it was still rather unhealthy food since it's highly processed, which is another one of the reasons why probably there wasn't a long-term benefit to using the non-sugar sweeteners. And something else that was found was the sweet receptors in the mouth that travel to the brain that are activated by sugar are the same receptors that are activated by the non-sugar sweeteners or the sugar substitutes, albeit through a slightly different pathway. But it provides the same kind of sensation, pleasurable sensation to the brain when we're having something sweet. So the brain can't really tell the difference between the two. And if you notice, complications of the two kind of sound the same. Excess sugar, more risk for diabetes, heart disease. For the non-sugar sweeteners, long-term more risk for diabetes and heart disease. If you noticed in the group earlier this week when I posted about this guideline, I did mention that the guideline does not apply to diabetics, and you probably want to know why. The reason is, oh, I see that Manga says she doesn't like the taste of artificial sweeteners too. That is true for some people, like my brothers don't like it. I don't really notice a difference for most of them. I don't particularly care for Sweet and Low myself, and I didn't even really realize it was saccharin. But some of them, yes, some of them people don't really like. And interestingly too, using the artificial sweeteners doesn't actually decrease sugar cravings. So somehow it's still activating the receptor, but it's still not really satisfying the sugar craving, research has found. But I digress. So going back to why the guideline doesn't apply to diabetics. So as you recall, the study was done by WHO to look at whether the non-sugar sweeteners helped with weight loss or helped to reduce the risk of non-communicable diseases. So diabetes is a non-communicable disease. So if you already had it, you already had diabetes, you were excluded from the studies. So these studies were, for the most part, not done in diabetics. This does not mean that the non-sugar sweeteners are recommended in large amounts for diabetics. Quite honestly, the sugar recommendations are the same for diabetics and non-diabetics. It's very small, 9 teaspoons or less for the average male and 6 teaspoons or less for the average female. If you think about it, 1 can of regular soda has about 10 teaspoons of sugar. So we would all benefit from just avoiding sugar as much as possible. And actually what the World Health Organization recommends is replacing free sugar with naturally occurring sources of sugar, like sugar from fruits and sugar from minimally processed foods and unsweetened beverages. That's recommended. So in summary, non-sugar sweeteners may not be that much better for our health overall than sugar. The main thing is that, yeah, maybe they're calorie-free and have less calories, but as you can see from the data that's been presented so far, both sugar and non-sugar sweeteners wind up with the same kind of complications at the end of the day. So for everybody, limiting the amount of both of these is probably a good idea for our overall health, which actually translates into limiting the amount of processed foods that we eat. The less processed foods and the more natural foods, whole foods we're eating, the better for our overall health. And again, research is still ongoing with the non-sugar sweeteners.